Hey everyone, my name is Sienna Boyd and we are in the Choose Health studio, but technically we are at the kitchen in Sun City. We just finished filming a cooking show with Dr. Ching,
Yes.
who is our internist who practices out of our Hemet location.
Hi, everyone.
Today we're not going to be talking about food, although we do have what we made right in front of us. What did we make?
We made a traditional Chinese steamed dish, which consists of traditionally usually live fish, but today we're using like a fillet of swai.
Oh, I am so excited to try it. But we're not talking about food today. Today, I wanted to chat with you a little bit about preventative medicine. So I know that's a big topic, especially in our older adults. There's a lot of things that they can do to make sure that they are practicing their preventative medicine and catching things preemptively.
Yes.
And so can you tell us a little bit about the importance of preventative medicine?
Absolutely. Preventative medicine is something that, it starts off when you're born, actually, as an infant. There's many things that actually, you get vaccinations and you get, your routine checkups, and all that is to make sure that, that we try to ward off any, illnesses or diseases. And even before you're born, actually, there's a lot of preventative medicine that goes into that, because with the mother, they go through a lot of, regular visits with their OB-GYN doctor or their family doctor to make sure that the baby's doing well, and with ultrasounding and making sure that everything. So preventative even stretches back as far as that.
So preventative medicine is more just when, not that you have anything immediate going on, but rather just making sure that you're checking everything to ensure that you are healthy moving forward.
Right.
And to catch anything if there is something wrong within your body that you're not necessarily aware of.
Absolutely.
As people collect more birthdays, as Dr. Banala likes to say, what are some of the screenings that our older adults should do when in pertaining to preventative medicine?
Yeah, absolutely. Well, as an internist, my preventive medicine starts for folks who are, 18 and older.
Okay.
And at that point in time, if I do have folks in their younger years, especially like females, one of the key preventative things that we do advise is for cervical cancer screening.
Okay.
And that involves performing like pap smears, where we assess and determine if there's any risks for cervical cancer.
Is that yearly? Is that something that someone should do, or is it every 5 years, or how often would you say?
That actually starts at the age of 21.
Okay.
Yeah, and it occurs every 3 years up until the age of 29. And thereafter, if you do a co-testing with the pap smear, HPV co-testing, you can have it every 5 years.
Okay.
Yeah.
Interesting. So that's for our younger female population.
Yes.
As you age and grow as a female, what other preventative measures would you encourage people to do?
Yes. So, as the female ages, we typically do the cervical cancer screening up until age 65.
Oh, okay.
And but when they hit age 50, that's when we start to recommend breast cancer screening.
Oh, okay.
And breast cancer screening involves the usage of a mammography to look into that. But we always, delve into their medical history, their family history, because if there has been a prior history in the family, then we would determine what would be maybe an earlier time for them to be screened for breast cancer.
Okay, that's great. So depending on whether or not you have a history of breast cancer, depends on the age necessarily on when you would do preventative screenings.
Yeah, but in the general population, that we would recommend at age 50.
Age 50. Okay, so we're at 50 years old.
Yeah.
Okay, keep us going. As we get older, what other measures do we need to take?
Well, as we get older, we also, we consider the men as well.
Okay.
And for both men.
A big part of our population, those men.
Absolutely. Well, for both men and women, we generally recommend screening for colon cancer at the age of 50.
So at 50, it's breast cancer for women, colon cancer for men.
And women too.
And women, okay, so both. So both for the age 50, okay.
Yeah, so colon cancer for both men and women.
Okay.
We start at the age of 50, and generally we go to the age of 75.
Okay, perfect. And how, is it weird to ask like how that's done, or how someone would set that up with you?
Yeah, so screening for colon cancer is very important, and especially at that age range, that's why they recommend it starting at age 50, because that's when things start to present itself. But we want to try to catch them before it's too late. So that's why they recommend at the age of 50 where screening should be implemented.
Okay.
And generally, the gold standard for screening involves a colonoscopy, which is the usage of a camera, and where it's a flexible camera that they can allow the doctor to actually visualize the colon and determine if there's any abnormal lesions or abnormal polyps that need to be taken care of.
Oh man, okay.
Yeah, but that's the gold standard. There's alternatives, and I know that colonoscopies are not for everybody, but we can always discuss about it and talk about maybe alternatives, and just find a way that we can encourage people to get this done. And because it makes a world of a difference if we start early.
Oh gosh, it is so important. I know it can be daunting, obviously, doing these different assessments, just because your schedule, it can be uncomfortable. There's so many different reasons why people wouldn't necessarily do these screenings, but like you said, catching things early is just so much a part of preventative medicine.
Absolutely, yes.
And again, as we collect more birthdays and we get older, there are other, I know we've talked before about osteoporosis and bone density scans. Can you chat a little bit more about that?
Yeah, osteoporosis, is something that can occur in the later years of life. And we generally recommend that for women to get screened at 65 years old with something called a DEXA scan, DEXA. And it's a special type of x-ray that visualizes your spine and your hip bone to determine if you do have any osteoporosis or perhaps osteopenia, which is like a precursor to that.
Oh, okay, yes.
Yeah, so for women, we generally tend to recommend at age 65, and then for the men, we recommend at age 70.
Okay, perfect. I mean, that's another such important thing to get your bones scanned, especially just to make sure that you're taking the right medication, strengthening your bones with strength training and good food. And so as you get these scans back, what would be the next step? Would that be within you and your clinic as an internist, or would you refer out to different specialists if needed?
No, certainly we are more than capable of being able to take care of you if you do have a history of osteoporosis. So we can certainly take care of you.
That's wonderful. Well, Dr. Ching, thank you so much for being with us today. Just chatting a little bit about how to use preventative medicine, what we can do within Rancho family in our clinic. If you are looking for a new primary care doctor, specifically one who specializes in internal medicine, Dr. Ching is absolutely accepting new patients at our Hemet location. You can always give us a call and we'll be able to connect you with Dr. Ching. So thank you so much for being with us today.
Absolutely. It's always wonderful being here. So thank you for having me.
And now I'm going to eat what we cooked. I'm so excited. Have a great day.
Have a great day. Bye-bye.